Good afternoon. And today we have a very special guest, Dr. Katy Kennedy. Katy is inventor and founder of a beauty balloon. I have it in both colors, pink for girls and green for boys, for men. Good afternoon, Katy.
Hi, thank you, Maria, for having me today. I'm so excited to come on and talk with you about Beauty Balloon. Just a little bit of my background. I am double boarded in pathology in both anatomic and clinical pathology. So, my background is spending many, many years, many, many hours looking at tissue through the microscope. So I just, I've seen all the different chronic diseases that we would love to try to prevent getting to these end stages. I've seen the detriments, hypertension, type 2 diabetes, morbid obesity, metabolic syndrome, what it does to your liver, your gallbladder, and all of the changes that can happen as we age and these types of things. So it kind of catapulted me into this space because I realized how important it is that we have a healthy functioning airway, and everything begins up here in the head and neck as we feed oxygen, and which is the most important nutrient for the body. So I got into this in my own personal journey, my own health. I am a chronic allergy sufferer for many, many years. And this was a way for me to really help strengthen back the correct muscles so I could nasal breathe and not mouth breathe. And I could have the proper tongue position of it up on the palate. And it took some time. It took some time for me to kind of figure it out and really study. And without it, I don't think I would be where I am in terms of my health today if I was not doing this exercise on a daily basis. I went into the gym this morning and I used my beauty balloon. I laugh and I say I use it in the car, but that is exactly what I do because we're busy and you have to carve it out. And like I said, I don't think I would be nasal breathing through my workout through the entire time that I'm sleeping at night without doing these types of exercises. But it first started with being aware of what I was doing, educating myself. And then I ended up creating this because I couldn't do some of the exercises without a tool. I was kind of a little uncoordinated when I was trying to do some of these exercises, and I knew I needed a tool. And so that's how I created the tool.
Perfect. That's impressive story. And I want to say thank you to our audience. If you have a trouble sleeping or sleep next to the snoring partner and you want to help you and your partner, maybe paying attention to your body and giving some help, holistic help to your body through exercise and the beauty balloon. It's actually, we talk a lot about myofunctional therapy and what you can do, but it's the first time we have the tool. We have a resistance band what you can use with those exercises. And if you're a medical professional who, just like us, very passionate about making the patients happy and healthy, this program would be for you, because only together through different approaches, different pieces of puzzle, we can address this disease of evolution called sleep apnea or sleep and breathing disorders. And I want to add a little bit to the story of what Dr. Kennedy mentioned already about herself. We met during MUCON, during the conference, when we talk about tongue strength and breathing, and different people, actually patients and practitioners, were together and they did the presentation. And I was impressed with the elegance of presentation of a beauty balloon, and Katy was the first person who I approached. But I become very interested in the inside of this story of a doctor who's a pathologist, doctor who see actually the results of the disease under the microscope, come up with a solution to rejuvenate the tissues. I think it's very deep I think it's a very philosophical way what you create the beauty balloon. And I know there is a very special story why you call it a balloon. So
That's
why did you
exactly
call
right.
this a balloon?
Yes, Maria. So as I started to do the exercises, and these exercises that are done with the beauty balloon are done within all of our wonderful disciplines of physical therapy, occupational therapy, speech and language pathology, and myofunctional therapy. And I also noticed that many of the similar types of moves are also done in what is a very large aesthetic space in face yoga. And so, whether those folks really kind of realize it or not, they're doing preventative medicine with a lot of these exercises and tongue strengthening exercises that they're doing. So, I started to really look from a very broad picture. Wow, there's a lot of overlap within all of these wonderful disciplines to bring back the health. So, I started originally with medical grade balloons. And as a pathologist, all of the tubes and everything that's removed from a patient's body makes its way through the lab, whether it's the catheter, all of it, all of the waste, all of everything that's removed. So I see medical grade balloons, and we use a balloon in just about every medical procedure that you can think of, in every orifice that we have a medical grade balloon, whether it's esophageal dilatation, whether it's sinuplasty to open up the nasal passages, the airway. We open up blood vessels with angioplasty, very tiny little balloons that our interventional radiologist or cardiologist can get into the arteries, coronary arteries, and open those up. So I thought, oh, I could do this with a balloon, of course, and the material's safe. We already know this. It's safe to use in the mouth. Went through every type of balloon, every different odd shape that you can think of, and it didn't work. So after multiple attempts and working with a wonderful company that makes medical grade balloons in the US, I had to branch out. So I really needed to look better. The shape wasn't working. A cylindrical shape does not work in the oral cavity. And so I said, there is a way to engage these muscles. There's a way to strengthen them with resistance training, just like we do the body. There's so many creative ways that we do resistance training with the body. So many clever things have been created. Well, I was in a building. I was actually in the airport, and I was looking, Maria, up at the ceiling, and the ceiling was this big, huge arch of a ceiling, big dome, big arch. Well, the support structure were all triangles. The whole thing were triangles. That's when it dawned on me that the arches in the oral cavity, the palatal arch, the dental arch, that a triangle is extremely complementary to insert and use in and around the oral cavity, within the buccal mucosa, tucked up underneath the upper lip, the lower lip. And sure enough, I came home, and my husband's also a physician, we made some prototypes, and it went from there. And I was lucky. I found a good prototype maker. And then I realized this is great because this is flexible, compressible material, and it's food contact safe, FDA approved silicone material.
Fantastic. No, that's a beautiful story. Your story remind me in a way of Leonardo da Vinci's story, how he come up with a different visual inventions, like from you look at the nature, or you look at the architecture, and you said, okay, that's the idea. And I want to add something about face yoga. We had your friend Coco with her exercise on our channel, and that was, a lot of people resonate with that interview. And now, now we have tools, we have a resistance band, what we can do the exercise. And I would like to ask you, how beauty balloon can help with the lifting of the cheeks to create that triangle of beauty you talk about on your website. So what exercise we should do, and I'm going to do it with you, and I hope our listeners going to do it with us.
Yes, absolutely.
So
what we can do, what we can do. So the triangle of youth, and I use this because this is the gold standard in aesthetic medicine. So my colleagues in plastic surgery and dermatology, that's their goal, is to achieve or maintain the triangle of youth, which is a more lifted face. What we want to avoid is the pyramid of age. So when you have this is when everything goes south, right? Our jowls and everything goes south. So we're fighting the pyramid of age. We want to maintain the triangle of youth, defined by high cheekbones, full cheeks, and a defined jawline. Those are the three features that define the triangle of youth. And so that's what aesthetic medicine is working toward. It's that simple. And so one of the things that in my mind, looking at it, Maria, one of the layers, the tissue layers that is ignored is muscle. My colleagues, they're injecting the fillers and all these other things to help plump up the cheeks and the lips, and they're injecting it in the deep dermis or the subcutaneous tissue. If they're doing it along the jawline, they're actually putting it on the periosteum, along the bone. And the reason they're doing that is because they want to bring back contours and shape. But what do we do about the muscle? We know muscle is so important. Muscle, if you want to get a six-pack abs, you have to do sit-ups. It's muscle. We want muscle to be hypertrophied. And when I say hypertrophied, that's a healthy hypertrophy. So we want to keep our muscles as tight, toned, and strong as we can. But you can't really do it unless you add resistance. You got to add in resistance, and you have to lengthen the muscle and get it to contract harder. So let's do the cheek pops. I call these the cheek pops.
Yeah.
Grab the apex there at the attachment site. And I always say it's an elegant, graceful in and out into the oral cavity. As you twist it into the mouth, you're going to just lightly tap your teeth. And that helps to keep the jaw symmetrical and at a specific open amount. Then you're going to clamp your lips and say, "Oh," onto the apex where my fingers are. And then you're going to pop and contract up the cheeks, but you don't squint your eyes and you don't raise your forehead. So all these cheek pops, lip plank, because you're squeezing with your lips like a plank, and then you're raising up your cheeks. Ready?
Yeah, I have to practice. That's not so easy to do, but it's very important to move up the cheeks. And I notice, and I want to tell to our audience, it's very important. Don't include other muscles. Keep mirror. Always do it in the front of the mirror. Make sure your forehead not participating or glabella not forming number 11. You just want the cheeks up.
That's exactly right. And of course, the muscles that we're tugging on are the two zygomaticus muscles, major and minor. And so we're pulling on that good bone, that zygomatic arch, as we're doing that. And as you say the O, your orbicularis oris, the deep fibers in particular, are working really hard, holding that isometric contraction along the tool. So it's a win-win. You're getting your orbicularis oris, so you're going to be able to strengthen your lip, so you have a really good lip seal, right? We want to have a good lip seal. And from the aesthetic end, right? So that's the functional end, is our lip seal, of course, right? We want to be able to hold food. We don't want to have drooling. We don't want to have these other issues as we age, and the lip seal strength weakens. If we're snoring in the open mouth position, or obstructive sleep apnea, or any other sleep-related breathing disorder, we don't want that open mouth position. So having a strong lip seal strength with a strong orbicularis oris muscle is really important. And these are simple, fun, and I try to make this fun and really positive for patients with issues to do, and those of us that don't have necessarily true health issues yet, but we want to do this as a preventative means. Just like we do fall prevention, Maria, we're doing fall prevention exercises. Let's do these types of exercises so we don't go down the bad pathway of snoring and then eventually to obstructive sleep apnea. Let's avoid that. Let's build up our muscle reserve in our tongue, lips, and cheeks, as I call it. Tongue, lips, and cheeks. Remember, little tender loving care for your tongue, lips, and cheeks is what I call it. So let's get all these muscles nice, tight, and toned and firm, and prevent these types of issues.
I have a question. Can you please show us the exercise? A lot of people are so concerned about double chin.
Yes.
And you just mentioned about the tongue. What people can do to make tongue work, you know, in my area, I always see people forget about the tongue. They don't use the tongue, but
I know.
with the
I know.
resistance band, like we are modern people, we live in this present time when tongue, you know, just there.
I know. Whoever would have thought that the tongue holds the key to true aesthetic beauty as well as function, right? So we want to keep a strong tongue, not just for the functional end. We know those good functions, swallowing, speech, articulation, all of those important functions, and of course, nasal breathing. But the double chin, the jawline, that's what we want to, that's what a lot of us want to really work on too. I take the original triangle, single, and I put the apex behind the lower teeth, and I will hold it with my tongue. And then as the advanced move, this is isolating the tongue. So you don't, no one should compensate with their jaw or any of the other muscles, and just hold it open wide and try not to let the base touch the upper teeth or the upper lip. And you can also try to lift the back of the tongue up to the palate in that position, which is very challenging. And that's an advanced move. That would be an advanced move. Then another advanced move is to actually take the tool and let it just move it side to side along the lower teeth and the gum. So I'll show you because I've been doing these a while, so I'm very strong in here.
Very challenging. I feel it inside. Yes. Wait, that's hard. I even drop it. I have to work on it.
It's very hard. And then when you take the back of the tongue in that position, you can say the letter K or the letter G. Like I said, a lot of these exercises are already done. What I have done is created a tool to up it, to make it harder, take it to the next level with resistance training. So lift that back tongue by saying K, the letter K as in kick, or G, and get it up there, but still hold steady the tool.
Difficult, and I do it with my patients all the time, but I feel it. And I really like how you mentioned what we focus on going to the gym and exercise from clavicles down. But what about the muscles from the clavicle up?
That's exactly right. And they play such an important role, and they will decondition and they will atrophy with aging. Right now, the month of October is Global Menopause Awareness Month. And particularly for women, will catch up to men in terms of snoring, which you would see this in your practice, Maria, as they reach menopause. And so we want to be aware of that. And that's part of being aware and educating. We can do things to avoid going down that pathway of snoring. And so keeping that tongue strong, don't let estrogen walk out the door and let your muscles atrophy and decondition. Keep the muscle strength, keep your muscles tight and tone. And this is simple. It only takes a few minutes a day. Now that you have resistance training, you can get there faster, quicker, maintain it. Now that you can use tools like this and using them together.
My question to you, a lot of people don't want to look sad, especially now it's a fall. They want to make sure what corners of the mouth stay up. What the exercise to kind of smoothen the nasolabial fall, that's the place for fillers, and make sure you keep the corners of the mouth up.
Yes, there's so many, Maria. There's so many exercises. I have a book, the instruction booklet. I have over 30
the
exercises.
Book is great. Such an elegant book.
Yes, there's so many exercises, and actually there's so many more too that I couldn't fit. At some point I had to kind of cut it off because there's so many. But you can do, we'll just do this one. I call this the cheek tug, and you can insert the tool where you put one of the two triangles in the buccal mucosa. Then you use your other hand to support your lips. And it's just a light tug. I call it the cheek tug, but you're pulling on that side, the commissure of the lip, which ladies, we really, I know everybody hates that. So, and then you can twist it, bring it around. You never have to let the tool leave the mouth, and you can bring it around to the other side and do the other side. So here, let me show you just one in and one out. Let me show you real quick. So you go like this.
No, one in and one out. I do double. Yes. I did the wrong one. Okay. Wait.
And it's very gentle. It's a very gentle tug. What you'll see is people use their fingers. Some people, and you can put your hand, Maria, a little bit more on the front of your lips. Put it on the front of your lips to support your lip, because you're really just focusing right there on that nice side. And people will use their hands a lot of the time. And that was something that I was observing. People were using their hands and their fingers. And some people, you don't want to do that. And you can't hold that for a long period of time, but very gentle. Then you flip it to the other side and very gentle. And I'll show you. It's a very gentle move, just a gentle tug on that lip corner, or commissure is the anatomic name of it. So here, very gentle. And then twist. Very gentle.
I know anatomy wise, I have orbicularis oris, but I never feel this muscle, like how you feel the muscle after the gym. So now I do feel it. It's really working. And, I can feel what my muscles been working, trying to hold this triangle.
And what I love about it, if someone has unilateral paralysis on one side.
Oh, yes.
What I love about the tools is I purposely created it so you could use them bilaterally, or you could use them unilaterally. So if you're anybody who might be watching that is a therapist that's dealing with somebody that has either illness or trauma for whatever reason, stroke rehab, Bell's palsy, right? These can be used unilaterally or bilaterally. They can be inserted into the cheek, where you can inflate the cheek. You can suck in the cheek to strengthen the buccinator, the rhizoris, to bring back that function, and also for us to lift the jowls. We want all these muscles to be nice, tight, and firm, and that's one way. And then you can stick the tongue through the triangle. I'm going to show you this one too, because this also helps exactly what we're talking about, Maria, keeping the corners of the mouth and all of this perioral area. This perioral area is very, very difficult to rejuvenate from an aesthetic standpoint without doing some type of invasive procedure. They're doing the lip lifts and, of course, the fillers. And one thing I want to make, it doesn't have to be one or the other. It doesn't have to be one or the other. This can complement fillers. And I think what people will find is you can dial back and use a little bit less filler over time, because you're building a strong muscle. When the muscle becomes very strong and toned, that filler, you can use probably a little bit less and get a really great result, a more natural result. And the movement will even be a little bit more natural. And wouldn't it be nice to save a little bit of money and not be stuck as many times, because some of those procedures can be very expensive, as we know.
Of course.
So let me show you what I really do like too. And again, this is one I'll do in the car like this, just to keep this area, this perioral region and the jowl area and the corners of the mouth and the double chin all nice and tight, because I'm using the tongue, I'm using the cheek muscles, and I'm using the lip muscle. So here. Now,
difficult, but I feel it.
And so manipulating it in around, because you have to have control. You have to have control of these muscles, and they have to get strong. What I love about this too, it helps again with movement of food bolus. We know with the geriatric population, the food bolus will get stuck. It'll allow us to be able to push that food bolus right back midline and swallow much easier. So we really want to keep these areas stronger too as we age, and particularly as we enter perimenopause, menopause. And these changes, as we know, are very slow and insidious. You may not notice. We can
resist them. Yes.
Until all of a sudden you're coughing, you're choking, They're very insidious. And I will tell you too, Maria, I would love to see my tools used in the nursing home setting.
Yes,
Where greater than
yes.
50% or more of the patient base suffers from oropharyngeal dysphagia in one form or the other. A lot of it is tongue strength, tongue strengthening. And the big area that my tools really do target is the tongue. I really
Great.
wanted the tongue to be the main focus because it is the tongue that dictates so much in terms of our health, function in this area, and aesthetics. And it's a
Thank
quirky
you.
little
Fantastic.
organ.
Thank you very much. We appreciate it so much. And with those exercises, recommend it to your relatives, people who have trouble swallowing. So we really appreciate, doctor, for your, sharing your expertise with us. Thank you.